Hey everyone, Dr. Solmas here, and today I wanted to talk to you about breast cancer screening. This is a very large topic and I could talk about it for hours, but today I wanted to just touch on some points that could be areas of confusion for people and hopefully clarify those for you. So, first of all, when we as physicians make recommendations to our patients on breast cancer screening, where are we getting this information from? What guidelines are we using? So, typically, we look at different organizations that are made up of panels of physicians and disease experts, such as the United States Preventative Services Task Force or the American Cancer Society. There are many, many other organizations, but those are two of the large ones that we look to for their screening guidelines. So, what does the United States Preventive Services Task Force say? They recommend that women between the ages of 50 and 74 who are at average risk for breast cancer be screened for breast cancer with a mammogram once every 2 years. Any woman between the ages of 40 and 49 should have a conversation with their physician to determine when is the best time to start screening for breast cancer. Okay? Now let's take a look at what the American Cancer Society says. They recommend that women between the ages of 45 and 54 be screened with a mammogram once every year, okay? And then after the age of 54, they can reduce the frequency of the mammogram to once every 2 years. Women between the ages of 40 and 44 should have a discussion with their physician on when to start screening. Now, I, as an internal medicine physician, I am more conservative, more aggressive in my approach, and I recommend to my patients who are at average risk for breast cancer to start screening with a mammogram yearly at the age of 40. Okay? Now, what are the different modalities that we have for breast cancer screening? So, for most women, the best screening tool that we have is a mammogram, which is essentially an x-ray of the breast. Okay, it is the best way to detect early breast cancers before they become a lump, before they become detectable by physical exam. Mammogram is our best screening tool. Now, for women who are at higher risk, sometimes we recommend an MRI, which basically uses magnets and radio waves to take a picture of the breast. All right? And then finally, we have ultrasound. So when the radiologist reads mammogram reports, oftentimes they will comment on the density of the breasts. And in women with very dense breasts, okay, it is, first of all, women with very dense breasts have a higher risk of breast cancer. We don't know why. And women with very dense breasts, it's very hard sometimes to pick up the cancer on the mammogram. And the reason for that is because a woman with dense breasts, the white that we see on the mammogram, the white areas, that is breast tissue. But breast tumors, breast cancers, are often also white on the mammogram. So it's really hard to differentiate and to pick up breast cancers on mammograms in women with very dense breasts. So in some states, it's required for the radiologist to let the patient know about how dense their breasts are, and sometimes we will make a recommendation to have an ultrasound done as well for the woman with very dense breasts. So those are the three different modalities that we have for breast cancer screening. I wanted to also make the point that if you have a first-degree relative, for example, your mother was diagnosed with breast cancer at a certain age, we start screening you for breast cancer 10 years before that first-degree relative was diagnosed. So, for example, if you come to me and you're a 22-year-old patient, okay, and you tell me that your mother was diagnosed with breast cancer at 43 years of age, we're going to start screening you for breast cancer at the age of 33, which is 10 years before your mother's diagnosis, to be extra aggressive with your screening. Okay? The other thing I wanted to say is that while breast self-exams are not currently they're not recommended for detection of breast cancer, I still recommend for my patients to do them monthly. And the reason for that is because it is important to be aware of your breasts and any changes in your breasts. So, whether it's the skin or whether it's the actual breast tissue, knowing what's normal for your own body is very powerful and very important, because then if there's a change, you are more likely to detect it. I also recommend to my patients that it's a good idea to do the breast exam not right before your period begins, but to do it after your period is over, because at that time you have less hormonal fluctuations that could cause more sort of lumps and bumps in your breasts, like the fibroglandular tissue, to become more prominent before your menses. So it's always a good idea to do it after your period is over. So I hope that you found this video helpful. I hope that if you are due or past due for your screening, please schedule it. Please stay on top of it. It's very important. It is Breast Cancer Awareness Month, but really we always need to be aware of our breasts and stay on top of our healthcare maintenance. So take good care, and I will be sharing more with you soon.